PD 1000 Exploring Health Professions course for us before. I know a lot of you are either in the course or have taken the course. And so she's intimately connected with the course and brought a unique perspective as a UC alum, as a public health expert. So anything that you want to chime in about that today too, Dr. Hardee, to add to the conversation would be much appreciated.
Awesome. And I need to switch to active speaker view. Is that a thing?
Yeah, up on the top right, there are some icons that you can change the view, the present view. Yeah. Perfect. And then are you also able to see the chat button down at the bottom?
Yep. That's where I got that from. Okay, perfect. It's all together. All right. So do you want me to just start away? Because I know we had limited time. And it might be easier if I just throw it all out there, and then please feel free to ask me any questions if you hear anything that sparks your interest or anything like that.
Yeah, Josh Norrie is actually with us. He's the intern for the Healthcare Workforce Diversity Symposium. So he's been facilitating some of the exchanges with our healthcare professionals. And then at times I'll chime in just to draw on some other things that I've heard. And so Josh will actually lead us off with a question for you, Dr. Hardee.
Perfect. I'm excited. Hey, Josh. Good morning.
Good morning to you. How are you feeling?
I'm great. No complaints.
Okay, glad to hear that. Do you want to start us off with why did you decide to go into public health?
Well, like many public health professionals, I didn't originally know what public health was. So it's not like I knew that was a major when I was coming out of high school. I actually started in pre-physical therapy athletic training. So I was in athletic training and I was taking classes because I thought I wanted to be a physical therapist when I graduated. And found I loved athletic training. I loved sports medicine. I loved all that work. But I didn't see that lifestyle in my future. So it was me trying to figure out what did I really love about medicine and like the health field, and how could that like work in my future. And I also had a research experience as well at UC. And then I realized that research wasn't always just in the lab. So, I didn't really understand any research other than just bench research. And when I realized that there was community-based participatory research, action research, just all of those things, and how a lot of, health behaviors were changed. So all those things kind of happened all my junior year of college. And I was able to kind of easily transition from athletic training to public health, since a lot of my electives were in public health. So I knew what it was, but I just didn't know what a job looked like in the future. And my family and I laugh about that now because they were like, who are you changing your major to? What are you going to do? So it was kind of nerve-wracking for everyone because even I wasn't sure. But as I spent more time in classes and realized what professionals and had more experience-based learning opportunities, I identified like, oh, this is what people in public health do, and a variety of different things.
So what exactly was it that drew you towards? Sorry. What exactly was it that drew you towards public health? Because I know you were talking about AT and all.
Yeah. It probably was the combination. Like I knew I loved health, like at all aspects. And it probably was the population level of work. So when I was in pre-physical therapy, it was kind of a one-on-one, and I really did like kind of having great relationships with students and helping them kind of rehab and all of that. But I really love the population level of work that could be done. And we would learn about, in my elective classes, we would learn about things like we don't think about now, but like seatbelts. And, and that was a public health push years ago. I never experienced it. I just knew I had to wear my seatbelt. But those type of public health practices that went into policy, that went into law, are things that we kind of just think that are second nature that happen. And I use that one as an example because I never knew that public health had anything to do with seatbelts, right? Yeah. And thinking about workplace safety. So it was kind of like that combination of I wanted health, but I was loving the things happening at a population health level. And I was like enamored by that. That was exciting to me.
Okay, sounds good. Could you talk to us a little bit about what a day in the life what a day in the life was like for you pre-COVID and now that we're in the pandemic?
Ooh, good one. Pre-COVID, it was meetings, but it was all over the place. So one of the things I probably love most about my job is that in the morning I could be meeting with a physician. Now that I work for the American Heart Association, specifically do like cardiovascular most often and things of that nature. So I can be meeting with a physician at 7:30 in the morning, and I could be at a community meeting, at a community council meeting at 7:30 in the evening. And I like that way to kind of explain it because public health goes from the, practitioner, I say high level where individuals are making decisions about your health and like on an individual basis, as well as community level where people are, how do we make our community healthier? How do we invest in our work? And how do we come together to change our community or say, what are our needs and how do we assess those? So it kind of runs the gambit. I also can meet with city council members and even work on a state level. So it varies, and that's what makes it really exciting because no day is the same. So I have no type of monotony in my days ever.
Oh, that sounds really cool. I just like how you can go from, meeting with a certain type of person one day and then someone completely different the next hour.
Yes, exactly.
Could you talk about what challenges you faced in this profession being a Black woman?
Ooh, that's a good one. Probably a lot. I'm most of the time the only one that looks like me in the room. And there are a lot of challenges because a lot of times I'm speaking on, I'm not gonna say speaking on behalf of a lot of Black women, but I have a very different perspective when it comes to a lot of things. Oh, I forgot to ask the second half of your questions. With COVID, that my days look the exact same. They just are all on Zoom. So I didn't answer that half. So I still do the same things. We have figured out how to have council meetings online. We figured out how to, have like now everybody's Zoom, Facebook Live, or something that we stream. So that is really good because we had to keep the work going. So I'll go back to but I wanted to say that public health has not stopped. If anything, it has gained a lot of traction. So if you are interested at all, there are definitely more public health jobs now than there were when I got out of school. But with being a Black woman in public health, I speak a lot of times from a very different place that my counterparts would, mainly just because a lot of times I'm the only one that looks like me in the room. And that's it's really a hard place to be in because I do not speak on behalf of all Black women, but I am very aware and cognizant of the issues that face the Black community specifically. So today I have a lot of conversations around menthol and the impact of menthol cigarettes in the African American community and how those have led to disparate health outcomes and long-term chronic illnesses for years, and like how that marketing and targeting has specifically affected us. So there are issues that I am definitely more passionate about when I talk about maternal health, when I talk about infant mortality. I speak from definitely a place of both interest in public health, but also knowing that these concerns and health concerns really impact us. So I won't say it's a fine line. It becomes a passion point even more. And it also is a little bit emotionally taxing because, I care because it could be me, and I care because it could be my family member as well. So it's a lot, but it also keeps me doing it. It keeps me so passionate about the work.
Okay. And you said that, most of the time you're the only one that looks like you in these meetings. So would you say that that's why it's important to you to diversify the healthcare field, just because to bring that perspective, since, you're the only woman of color in there?
Yeah. So in so many areas too. So I think that's another part. So, there are starting to definitely be more diversity, I would say, at least locally in public health, as we really work to have health commissioners and people in positions in leadership that then also work to diversify these fields. So those things really help with that work. But there's so many other different levels of work or different places that people don't traditionally think that play a huge role. So when we talk about, I'm after the election yesterday, but we talk about like city council people, right? Like the impact that they make on health outcomes, no one really thinks about that as their first to decide, but they put policies into place on a city level, right? And policies are so important to how we influence health outcomes. So thinking about policy systems, environmental change, there needs to be more diversity in every aspect of that health work. So not even just what I do at a nonprofit, but also our local government entities, also within school systems and individuals that specialize in public health to prioritize the health of our students. In transportation, right? How important is it for there? Obviously, within our healthcare access as well, how many public health people are really a part of not only the employee health, but the patient's health, and how is the hospital or clinic really working to improve the health of the entire population? So there's just so many areas where public health professionals can be, and it's working to diversify all of those areas. Epidemiologists, right? I mean, just thinking about now with COVID, the influx of epidemiologists, and we just didn't have enough. We didn't have enough before. We really don't have enough now as we see this influx of cases, and that is a skill. Epidemiology is a skill set, and it's actually really fun. I really wish I kind of maybe went that way, but I love policy work, so I can really do both. But just knowing all of that and diversifying in each one of those fields is so important.
Okay. I know earlier you said that you work for the American Heart Association, right?
Yes.
Talk about a little bit about the different things you can do with a public health degree and the path it takes to get there.
Yeah. So I work as Vice President of Health Strategy at the American Heart Association, and my job is to lead all of the funds that American Heart Association raises locally, how we activate those funds to really focus on community impact. So donors donate to certain initiatives like tobacco or healthy food access, or really working and focusing on hypertension control and managing hypertension within various parts of our communities, as we currently see about over 50% of people in Greater Cincinnati that have hypertension, and most actually don't know it. So just thinking about those numbers and how we work on that. And my whole job is strategy. How do we think high level to identify where strategic ways that we leverage resources, partner and collaborate with other nonprofits and clinics and people in the community to get these things done and really address these health issues. So that's there's a strategy part of the work. I will say as well on my team, there's like a program manager. So someone that is actually doing and making sure we're activating those ideas. So how are we doing the hypertension program that we work with faith-based communities? How are we actually making sure that implementation is happening? How are we evaluating the needs? How are we then evaluating the success of the program? And then, coming back to me, and we brainstorm together of, now that we've done that, how do we make this into a policy? What can be changed at a larger population level to say this faith-based entity has food here, and this is kind of pre-COVID, but let's just say they're always serving food. Is there ways for us to make those meals healthier, right? If we see that there's a large population of hypertension within this place, how do we work with the faith-based community to say, let's look at the menu and let's think about if your population has very, very high, 60%, 70% hypertension. Let's talk about maybe some low sodium options. Let's talk about how we can maybe increase some physical activity, things fun like Zumba and line dancing into this faith-based entity. So it's really creative. It can be in that way. I mentioned local health departments, individuals that do similar work about program implementation, as well as epidemiologists, the statistician, biostat, similar work, policy, teachers, right? I would be remiss if I didn't mention all the faculty that taught me research, and which is the basis of, public health, and really how we continue to do great work in public health is having our awesome researchers really evaluate things that are happening, and then we can really turn it into translational science to then put into new practice, right? So that work, what if we do this, and how do we have these conversations with researchers and have them in the room to really talk about what does the next step look like? How do we continue to improve the health of our communities long term? So all of those play huge roles in the importance of public health. It's like a public health army now. I feel like in this COVID craziness, I laughed because I in the beginning of the pandemic, I laughed and said, I remember learning about a pandemic in class. Like I vividly remember it, and I was like, that's never going to happen again, right? Like that's just something we learn about in class. And I really have to stop saying never, because I also said I was never going to get my PhD, and you see here where I am now. So I'm really going to just stop saying never. But I laugh about that because I'm like, now that we're living through it, I wish I would have just not said it. I know I didn't put the pandemic on us, but I mean, in public health, we thought of it as something that was in the past. We never really foresaw anything like this happening, and now we're living it within a pandemic again. So just thinking about how public health is really evolving, and there's definitely so many places to really grow and thrive. Oh, and I'll also just add, you can be in public health and also be in other fields. So I have really good friends that are public health nurses. I have friends that are physicians that also have their MPH. So they're working in as a physician, as a nurse, but they have really special qualifications that they do a little bit different work as well. So they may have special projects within their hospital or clinic that they work on as a public health nurse with that expertise. So I always love to say that because they are awesome parts of our team as well, because they have the clinical experience that I necessarily don't have, right? So they're integral parts to public health as well.
Okay, that's great. Had any advice to any students that would consider public health? What would it be?
I couldn't hear. It went in and out. What did you say?
If you had any advice that you can give to any students interested in public health, what would it be?
I would say take advantage, and this is probably even broader to any pre-health student at all. I would say take advantage of all the opportunities that are available at UC. I was definitely a person that did not say no, or I was a person that was always asking for awesome recommendation letters from faculty because I wanted to apply to everything. When I was at UC, I had tons of experience-based learning opportunities. It used to be called service learning. It used to be called all the things before. It's been a while since I've been there. So it was called something else even before that. Many internships, all of those things. And I had an opportunity to work at a local health department. I had an opportunity to work at a wellness center, and I had an opportunity to work at a rec, and then also within other nonprofit organizations. And those experiences then led to research opportunities at Cincinnati Children's and UC Health. Right. I was then interning on different experiences where I could use those to even continue to kind of buff my resume. And I really wasn't doing, I would be honest, I wasn't doing groundbreaking work, but I was in the trenches. So I knew what I was talking about. Right. So I was in those meetings and I was learning and soaking up like a sponge how this work happens. And then I had the opportunity to apply for an internship at the Centers for Disease Control and Prevention. And I didn't get it the first time. So I tried again and applied again the next year, and I got it. So at the end of my time at UC as an undergrad student, I went and worked at the CDC in Atlanta for an entire summer and worked, ironically, on a pandemic response team. But that's not the point. But I would not have had that opportunity, one, if I did not continue to apply, have great faculty that will, write you. I think those faculty relationships are so important, because you want to apply for everything. Faculty members still laugh at me. They're like, Angelica, apply for everything under the sun. From study abroad, I would also say that is really important, to every internship program. I had virtual internships with the Office of Global Health. And virtual internships were a thing before the pandemic. So I can't even imagine what will happen now as they will start to grow and blossom as you are able to have these experiences. So I say apply, apply, apply. Don't take no for an answer, and just continue to put yourself out there, because even if you find out that this organization isn't for you. I don't foresee myself at the moment going back to kind of federal government positions. I love the kind of autonomy. I love creating and innovation, and you don't have that in those government entities at the moment. So I knew CDC at that time wasn't for me, but I knew that because I had that experience. How would it have felt if I would have finally worked all my life and then got to the CDC and been like, man, this is not what I want. But I had that experience, and that really set my career up at a very, very young age. So I was just really then honing my skills while I was continuing in grad school.
Dr. Seltzer, do you have anything?
Great. Yeah, we have just about 5 minutes. So I did want to just give an opportunity to the folks that took time out of their morning to be here to see if anybody wanted to unmute their mic and ask Dr. Hardee a question. We have until 10 o'clock, so a few more minutes if anybody has a question.
Robin, I have one. Can you hear me?
Yeah. Thanks, Arthur.
This is Arthur Walton. How are you, doctor?
I'm good. How are you?
Wonderful. I'm an academic advisor, resource advisor, but I also wear a career development hat, and I'm always talking about skill sets and competencies. And what are the skill sets or competencies that a student should try to work towards acquiring in their coursework, their service learning, study abroad, research, internship experiences?
That's a great question. I think there's a ton, but the one that comes first to mind would be communication. And I say that because, and asking questions kind of bubbled into that. Because a lot of times I didn't know the answer, but I was always willing to say that I didn't know the answer and I wanted to learn more. And I think being able to be curious and be able to really speak up and say, I don't understand. Could you clarify that? Or I would like to learn more. So it's kind of like seeking to understand and seeking to continuously want to learn. I would say those are probably one of the biggest skills that even when I didn't 100% get it, right? And they know you don't know everything because you're an undergraduate student and you're still learning. I would say some of my best experiences were the ones where I didn't know a lot. And I was able to ask, graduate students as well as faculty that were doing research, could you explain? Could you walk me through that? And those were skills that I was then able to take and learn and adapt the next time. But if I didn't ask questions, if I didn't really work on my communication skills and kind of really, and it's not going to always be easy. I was definitely not a professional at it. I was nervous half the time in these rooms with 20 different research staff, and I'm the lonely undergraduate student that has like this amount of work, but I really want to learn this. I would say that's probably one of my biggest takeaways, kind of that communication skill set. And then also maybe flexibility. So this is the most flexible time in your life as an undergraduate student. In my personal opinion, I have never had as much flexibility as I did when I was an undergrad. So what can you get done in this time? Because it will go so fast. What can you be a part of? How can you really leverage those resources? What can you apply for? Those would probably be my two, flexibility and really honing your skills to be better after you leave, and then communication.
It's great. Thank you, Dr. Hardee. So we are just about at time, so we're going to close up. I did want to just give you an opportunity, if you're willing to have people reach out to you with, other questions or networking. Can you share? I know you're on LinkedIn, but if you also have any social media handles, Instagram, Twitter, that people can follow you on, can you drop those in the chat for us real quick?
I can. I'll put all of it in the chat. I will say I am not good at Twitter. I used to be, but I can't manage it all now.
These folks aren't even on. These folks aren't even on. So
what?
Yeah,
Really?
Yeah.
Yeah, I used to be really good at Twitter, and then I just I cannot handle all of these things. But I will put my LinkedIn in there, and then I will also put my Instagram. I mean, probably.
Yeah, that's great. Whatever you're willing to share. And then for anybody on the call, we just encourage you. This is what this event is about. This virtual connections and networking and staying in touch. So connect with Dr. Hardee. Thank you so much again for being here today. We really appreciate your time and expertise.
No problem. And good luck, all of my pre-health peeps. I'm looking forward to seeing you in the field in the future.
Thanks, everyone. Bye.